I go to my dentist regularly, or I go to my family doctor regularly. I was under the impression that as long as I'm going regularly, they would spot something and know if something was wrong with me. It must be okay. My jaw's popping, but the dentist doesn't say anything about it. Should be okay, right?
Well, not everyone in dentistry or medicine is really totally aware of all the parts of the temporomandibular joint problems and sleep problems that we've been talking about. It's one of the reasons that I participate as part of the faculty at the American Academy of Craniofacial Pain's Institute in Dallas, Texas, where we teach dentists how to recognize and deal with these problems. I also work with the Tufts University AACP program on sleep and its relationship to TMD, which is starting actually this fall of 2010.
I'm going to ask you to stand up. I don't mean to just pick on you there, but share you were young, you said your mom, somebody took you, you had pain that came down your...
Yeah, I was about junior in college, and kind of started, I noticed it at lunchtimes when I would eat sandwiches. I'd get pain from each ear hole all the way to my chin, and it was more or less like a severe cramping or muscle spasm that would just get really, really, really tight, to the point where, I couldn't move my jaw, or it'd be hard to talk, and there's nothing that alleviated. I'd like kind of try to massage it out or drink some water, and everything kind of seemed to irritate it more. And they'd last for spells of about like 30 to 45 minutes. And at first this would only happen like once a week or twice a week, and then it started happening more and more frequently every day, and then multiple times a day. And by that point I finally went to my mom, and I actually asked her if I had TMJ, because I'd heard about, that's the only thing I knew that was associated with jaw pain. And so she kind of asked around, and I think that's how she found Dr. Talley, and she sent me to him. And the first thing that we did was he gave me a temporary soft pain appliance that wasn't to heal the joint, but to alleviate, the facial cramping and stuff like that.
Did it take care of it?
Amazingly, yeah. Like if I would have a spell like that, and I popped that soft pain appliance in, it'd be gone.
Oh, wait. And now you're in a full-time appliance?
Yes. Now I'm in a nighttime appliance.
Okay.
Because I do have sleep apnea too, and I grind my teeth at night and stuff like that. So.
Your problems are gone, you said, pretty much.
Yeah, I have no problems during the day at all, like facial pain or anything like that. They've subsided completely gone within probably like 8 months.
Okay.
9 months. I mean, it became fewer and far between, but as long as I was diligent about wearing my appliance at night, I didn't have any problems during the day.
Okay. And now I want to talk, if you would, pass that microphone. I want to talk to you for a minute, if it's okay. You said you were in a car accident, and that brought on your symptoms, but it didn't, you just thought they were car accident symptoms, right? And you went for a year.
I was in a severe car accident that I had head injury and multiple injuries. He explained some of the, you see them in braces. Mine were a multitude of challenges. When I went to the dentist, because I had some cracks in my teeth, and I even lost a tooth, and I couldn't open very wide, and my dentist referred me to Dr. Talley.
And you told me that Dr. Talley helped you, but that he actually kind of stays involved with you with treatment with others to make sure.
Oh, definitely. I won't see a doctor without telling them to send a copy of my records to Dr. Talley.
Does he really ask that many more questions? Does he really
When I came to him and he sit down and interviewed me, and actually me not telling him what I was going through, but he actually explained to me what I was going through, I bawled, literally cried, because I thought nobody heard me. I was beginning to think I was crazy, because people make you think, it's all in your head.
I get people tell me we were starting to think we were crazy. The doctor, well, you're all shaking your head. So, yeah, I keep telling them, and it's like it's in my head because they can't figure out what's wrong with me.
And they want to give you some medicine. The medicine puts you out of sync.
Right.
And when he started treating me, for the discomfort first, the challenges with turning my neck, opening my mouth, even the challenges with the pain, because I had all of it. It ran through my fingers. Matter of fact, I have an implant now that it's a stimulator that was due to Dr. Talley's advice, with other doctors. All of my doctors, I have to
Run through Dr. Talley.
Send the information to Dr. Talley, and I'll tell Dr. Talley, well, I'm going to see such and such so-and-so. Would you please let them know what's happening to me, you know, before they treat me? So he's been amazing, and the appliance helped me to eat. I wouldn't even go and eat. I wouldn't go out, you know, and it helped me to be able to go out again. It took me a little while to get my confidence back, the depression, and those types of things.
You feel better, you're back living. I talked to
Oh,
everybody
yes.
earlier about what pain does to our life. Not only does it affect us, but you know, it makes us short with our relatives and friends and kids. It makes us not want to get involved in life. It robs us of any ability to actually enjoy life.
Absolutely.
And your friends, they don't know what to do.
They don't
you know,
understand.
yeah, they don't understand. You just don't want to go do anything.
Mike, it really does rob people of their quality of life. It has a tremendous affect on family relationships, interpersonal relationships, business issues, your profession or interest or career, school for those going through educational programs at any age. It changes people. It makes them withdraw from their typical normal things that they like to do because they have chronic headaches or facial pain, or their jaw doesn't work right and they are afraid to talk and chew around people. We've heard some people say today that they're afraid that food would fall out of their mouth the way their jaw didn't work correctly. So there's multiple reasons that people have an affect from this problem that goes beyond the problem itself. It really works on people. It really does a number on your mind with regard to your perception, because many people begin to believe they must be dreaming, they must be thinking that something this up because nobody accepts them, because they can't believe that some doctor hasn't found a solution for them because they've been looking at the wrong things.
Is that something that you really need before, just because somebody says they treat TMJ, should you find out a little bit about how much training they have, background they have? Tell us what you would want. We're out of time, we gotta go. Tell me what you would want people to know and obviously a lot of these people were referred by local doctors and physicians.
So Mike, this is very important that you understand that just because a dentist has a license to practice dentistry doesn't mean that they necessarily know that much about temporomandibular disorders. It's an orthopedic problem. It's not taught in dental schools very much at all. There's no formal programs in undergraduate schools in the United States that are of any substance. Some students get exposed to a little, but not very much. So it's very important that you look at the credentials of the individual that you're going to see. What is their background? How many cases have they treated? What do they do? How long have they been doing this? Have they just started this last year? Or did they been doing it for 39 years like I have, or some other time period? It's very important that they understand not only their credentials, but their experience and their ability to treat. It's critically important that you don't just pick someone because you picked them out of the phone book and they seem to be close to your house. You need someone who has that experience and credential.
With that said, we are completely out of time. Anything else I might want to know, find out, your website, we can go, you have all the information there.
So Mike, we have a website that it provides great educational information for patients. It is called tmj-pain.com, and it gives you information about our office, my staff, what we do, what I do. It has information that's both verbal and video clips, as well as information that's printed. It's very interactive. You can meet my staff. You can see what we do. You can listen to program information. You can understand about the things that we do in sleep and pain. And it helps a great number of people to have a guide to whatever they decide to do, whether they come to see us or to see someone else. But at least they have information, and it guides them into what to look for. It's a very, very interactive website.
I want to thank you again for allowing me to come out and interview you. It's been a pleasure. I want to thank all of you for coming out and taking the time to be here and share with us. You've been watching Medical News Network. For more information on this subject or any other, please visit our website at medicalnewsnetwork.net. Until next time, I wish you good health.